talking about recommendations, I think, is my favorite thing because we have a lot of great ideas, but I think when you take them and have to implement them, they are challenging. So some of the things in coding that I have experienced and found that are extremely important, especially now looking at RADV and OIG audits, focusing on quality and finding a way to really invest in your coding teams and your staff's training, staying on top of the coding guidelines, the model changes, and really just staying on top of how the coders are performing and your providers are as far as accuracy with documentation and the coding practices at the point of care. So I tend to think obviously more about my coding teams and how they're performing, but staying on top of certain conditions or certain codes that are troubling, quizzes, micro learnings, just really leveraging and focusing on teaching and training is of huge importance. The other thing that I think is important is making sure that, you know, at your plan, you have either a coding leadership team or someone at your plan who knows how and where to stay abreast of some of the trends and the industry changes, in particular, when we're talking about coding. So things like the OIG toolkit release, which I'll talk about in a little bit, but some of these resources are out there and people just don't know where to find them. Subscribing to notifications from OIG and CMS newsletters, the RegTap system for ACA and commercial updates. And one of the things I also believe is extremely interesting and is a tool is looking at the OIG actions and findings reports from other payers. Look at the recommendations, look at the findings, learn from that and act upon that proactively. And overall, just investing in a robust coding review strategy. So that may mean working with external partners if you have your own, internal coding team or are handling those retrospective reviews and provider audits in-house. Like I said, partnering with someone externally, leveraging other experts in the industry to add in some additional layers of review or some hybrid approaches to really make sure that you're touching as many records as you can to gain as much insight to then turn around and help influence what your strategy is going to be each season or each year. And then back to the OIG toolkit. This is a resource that I love. So back at Rise West last August, we heard Megan Tinker, who is the OIG chief of staff, talk about a toolkit that they were working on at that time. And, the idea was to mimic some of the techniques that OIG uses to identify these high error prone codes when they are auditing health plans. So the toolkit was released to the public just recently in December of 2023. So if you have not seen that resource, the toolkit is right out on the website on oig.hhs.gov under compliance. And the toolkit is downloadable in a PDF format. This is one of the tools that's readily available that I really view as a gift. When I was on the plan side, we spent a lot of time trying to build and create logic from scratch, different rules that we thought would help find, the most error prone codes and conditions, high risk groups like acute stroke and MI, and a lot of this is done for you. The SQL code is right there and is available for you. Some of the things that we know are high risk strokes and MIs, it's still alarming to see error rates that OIG is sharing in the toolkit of 97, 98%. Many of the cancers, lung, breast, colon, all in the 88 to 96% error rate range. And the other one that is interesting and they have put into the toolkit for you is nearly 3,800 different pairs of diagnosis codes that are typos or miskeyed diagnosis codes. Error rates for those as high as 81%. So if you use this, I think it's a good first step to identify where you're at as far as against your provider coding, your supplemental coding, and then learn from that. So take the baselines and figure out, are there some other unique combinations you can layer on top of this basic logic, looking for suspicious coding patterns like, a female with a prostate cancer diagnosis, or new cancer diagnoses and no additional claims, or very low dollar follow-ups after that initial diagnosis, discrepancies between your procedure codes and what should have been done at the visit and the diagnosis that's attached to it. And then, of course, our specialty surprises, things like cardiology diagnosing cancer, dermatology diagnosing diabetes. Many of those things you would be able to fold in and layer on top of the logic and really find, I think, some really great intel, and then also mitigating the risk for when your OIG and RADV audits do occur. And then my final recommendation, I would say, is technology. Leverage it as much as you can, but find a balance between technology and the human expertise that you need to aid in these efforts. I think they both definitely play a huge part. As my colleague Katie mentioned, looking for digital connections whenever possible to get your hands on the data. There are many downstream impacts when you're looking at medical record documentation that gets into the hands of the coders, that there may be mixed patient medical records, there may be missing signatures, there may be things that eventually can lead to coder errors. So if you can get further upstream and help remove some of those potential human errors, that is a definite awesome way to leverage technology and let it help us as much as possible. The other is with leveraging NLP in your coding software. So helping the coders with the review of the medical record, looking for key phrases and terms that might be overlooked when a coder is looking at a 500 or 1,000-page chart. So definitely two ways that technology can help with coding. And then just looking at new products, new offerings, additional expertise or partnership to help with your supplemental chart reviews. So looking at multi-layer approaches where maybe before having one vendor do that review was good enough, or your internal team was good enough with QA. Now I think people really need to start considering the ROI and the risks, and having perhaps another layer of review occur on top of that, just for some additional risk mitigation.